babies who love dummies, they're really using the suckling as one of their strategies for soothing themselves and calming down. And usually they're really wanting it at sleep time. So for parents who are having trouble with sleep, often they're like, oh, the dummy is really helpful in just helping my baby wind down and get off to sleep. I was saying earlier, those tricky moments, the dummy can be the constant for your baby. So if they go to childcare, lots of change around them, but if they can go and take their dummy, it's almost a bit like a comfort item in so many ways. It can make those transitions a little easier. And of course, if they're unwell, giving them that bit of comfort that sometimes we just can't give. You know, if we've got our hands full or you've got multiple babies, can be pretty challenging. There's also like some research that suggests that babies who use dummies have a lower risk for SIDS.
Yes.
One of the biggest downsides to dummies that you and I encounter in the clinic, Laura, would be that babies really can't replace the dummy themselves until they're around about that 7-month mark. They're going to need a parent to do it for them. So often a dummy will fall out of a baby's mouth at some point during a sleep cycle, and it can mean that they wake up at the end of that cycle. Like with any sleep association, they wake up and go, something's changed since I fell asleep. You know, my dummy's missing, and they call out and they want it replaced.
Yeah.
And it might be a very brief wake up. A lot of parents are like, oh, it's so quick and easy. I don't care if I have to do it 7 times, 8 times a night. But for other parents, it's just too much.
Yeah.
They don't manage it very well.